Good afternoon, everyone. I am Kate Lauman, social media consultant with SSM Health. Thanks for joining us today with our wellness webinar featuring Brent Swartzlander from St. Mary's Hospital in Centralia, Illinois. Brent has a doctoral degree in physical therapy, a specialty certification in orthopedics, and he's also a wellness coach. Now, this is our second topic in our wellness webinar series that are brought to you by the Human Resources team for 2015. Now, we're trying to give everyone valuable health information that they can really take away and use in their everyday lives. So today, Brent's going to talk about the key to leading a healthy lifestyle, especially dealing with a healthy diet and incorporating regular physical activity into your daily life. Brent wants to hear from you. He's going to give a short presentation, and then we will be answering your questions. So if you do have a question that you'd like Brent to answer, you can email us those questions. Our email address, AskSSM@ssmhc.com. So we're looking forward to hearing all your questions and answering those questions. But before we go any further, let's introduce Brent. Thanks for being with us.
Thanks, Kate. Thanks for having me today, and thanks for all your help getting this coordinated. Thanks for that introduction as well. I am also, though, a director of our Felician Wellness program here in Centralia, and along with those responsibilities, I also get to be a wellness coach for the adult portion of that program, and that's why I'm excited today to talk about movement and physical activity. And again, if you have any questions, please email us. Let's get started by talking about the physical activities guidelines. These were set out in 2008 by the government, specifically the U.S. Department of Human Services, and they compiled the research to give us the best idea of how to stay healthy with physical activity. These guidelines were actually meant to complement the dietary guidelines that they had previously set out. Now, if you're interested in that, I would suggest seeing Jennifer Moffitt's webinar. We have two ways to get to that. One is an internal portal through the HR department, and then the external link is through YouTube, and both of those are there for you if you are interested in looking at that. And let me say that physical activity will not overcome poor nutrition or a poor diet, so I highly suggest that you look at that webinar as well. Now, when the government set out to give us these activities guidelines, they came up with some very basic principles. First of all, they discovered that regular physical activity decreased the risk of many health issues, and health markers were improved. They also found, fairly obviously, that some physical activity is better than no physical activity at all. And then they also noted that as you increase intensity, frequency, and or the duration of the exercise or physical activity, you get greater and greater benefit. Currently, their recommendations for adults is 2.5 hours per week, and if you divide that out, it comes out to about 21 to 22 minutes per week of moderate exercise. And they do recommend that we do both aerobic and strengthening exercise, or what we refer to as resistance exercise, to get the best benefit. Another thing they found when they looked at the research, that there was no bias to physical activity, meaning that across the board, independent of age, race, ethnicity, or even those with disabilities, everyone gained health benefits from physical activity and movement. I'm going to briefly tell you about what they discovered with the children, but we are going to focus on the adults today. Now, with the children, because they have a little more energy than adults, the recommendations are a little higher. They want 60 minutes or more per day of physical activity, and that needs to be more of a moderate to vigorous activity, and at least 3 times a week it needs to be vigorous activity. With the adults, again, they noted that as the duration went up, the benefits went up. So taking it from 2.5 hours to 5 hours per week showed a marked increase in results. Again, muscle strengthening should be a part of that activity, and current recommendations are twice a week, and in our program we encourage even 3 times a week of resistance or strengthening exercise. Now let's first talk a little bit about safety. The first step with safety is to speak to your medical provider. Speak to your doctor, speak to your physical therapist before you start a program to make sure that you're healthy enough to start the program that you intend to start. The second one on the list is highlighted because it tends to be the place where people get hung up the most. Start with an activity level that is based on your fitness. This is where people sometimes bite off more than they can chew or jump too strongly out of the gate, and this can cause people to get frustrated and overwhelmed and tend to stop the program prematurely. Then we talk about, again, starting at a good place and then gradually increasing, and we'll repeat this theme throughout the discussion, but slowly increase over time so that your body can accommodate to the new program. Also, we like to talk a little bit about using safety gear when you are exercising. If you're going to bike, we want helmets, we want knee pads, elbow pads. If you are going to run or walk, we want good shoes. Good shoes are going to protect not only your feet, but your knees, your hips, and your back. So think about safety equipment before you get too far into your program. The other thing is exercising in safe areas. This has come up more and more as people have been exercising more lately. And think about things like if you're going to exercise at night, is it well lit? Are there other people around so that it's not secluded? There's actually even a recent research study about wearing headphones or earbuds when you're exercising, and that actually, if you're exercising out on the public streets, is possibly going to cause more accidents. People are distracted, they don't hear cars or vehicles coming, and actually may have more accidents because of the headphones or earbuds. So think about these things. There are a lot of walking trails that are available in safer areas that you can exercise in. Now, how do we get started on the program? Again, start with a realistic goal. The intensity, the frequency, and the duration will come over time. The main thing is try to make exercise part of your daily routine. If you're one of those who has a written out schedule, write it in. Put it on your schedule each day so you know when you intend to get your exercise. If you're not that specific with your schedule, try to think ahead at least a day or two as to when am I going to have the time to work this exercise in. Should I do it in the morning? Should I try to squeeze it in at lunch? Should I do it after work? Prepare yourself with contingency plans. If it rains that day, do you have something you can do indoors? If your workout partner cancels on you or the group gets canceled for some reason, do you have an alternative exercise program? Have options at home, at work, and in the gym so that if you don't make it to the gym one day, you have an option to get the exercise in that day. Keep track of your progress. There's research that shows that this will keep you motivated and interested in your program. This can be very simple as writing it in a small spiral-bound notebook each day, or you can get a little fancier by getting an app that will help you track that kind of thing. There are also forms downloadable off of the internet, especially some of the government websites, to help you track your progress. And as you make progress, give yourself a reward. Try to keep the reward specific to health and exercise. Healthy snacks, or if you hit a milestone, maybe a new pair of shoes if you like to walk or run, maybe some new music for your iPod if you like to use that as a distraction when you're working out. So try to make it fit your program to some degree. The research also tells us that having a workout partner is very helpful, finding a class, finding a group that is exercising, because if you feel obligated to show up, you're more likely to make it to your exercise session. The other thing we find in our program with the Felician Wellness Program is that varying the exercise makes a big difference, having options and alternatives so that you don't feel as though you're doing the same thing each day. And then lastly, find your motivator. We have people tell us all the time, I'm planning a trip and I know I'm going to have to do a lot of walking, or my grandkids are getting of an age where I want to be able to run and play with them. And that does become one of their motivators in our program. So find your motivator. What helps motivate you to stay with your program? And then also find those distractions. Again, be a little careful with the earbuds and the headphones if you're out on public streets, but otherwise watching TV as you use a stationary bike is a great way to pass the time and before you realize that you've done more than you thought you could. Briefly, I'm going to discuss health benefits for children. With exercise and physical activity, we see improved cardiorespiratory and muscle fitness in children. We see improved bone health. We see improved metabolic biomarkers or disease indicators in children who are active. And we see better body composition and weight control with kids who are active, and even reduction in symptoms of depression in kids who stay active. Health benefits for adults, there are many. I am going to go through them all because it is surprising how many benefits that adults gain from just staying active. First of all, you see a lowered risk of early death. There's a decrease in respiratory disease. There's a decreased risk of stroke, decreased risk of high blood pressure. We see improved lipid profiles on blood work. There's a decreased risk for type 2 diabetes. There's a lower risk of metabolic syndrome. Some people are not real familiar with metabolic syndrome, but it affects about 35% of the population, and unfortunately, it is on the rise. Metabolic syndrome is basically any three of the following five, which are abdominal obesity, high blood pressure, high blood sugar, high triglycerides, and low HDL. So any three of those puts you in that category, and it is a very high risk for further disease. Further health benefits, we see lower risk of certain cancers, especially colon cancer, lung cancer, endometrial, and breast cancers. There is a slowing of weight gain when you stay active, and there is potential for weight loss when you stay active. Again, in adults, we see cardiorespiratory and muscle fitness just like we do in the children. There is some indication that the more active we are, the less likely we are to have falls, and again, reduced depression symptoms in adults who stay active. We see improved cognitive function in older adults. We see improved daily function, meaning your daily routine is easier when you're more active. Reduced abdominal obesity in adults who stay active. We see a lower risk of hip fracture and an improvement in overall bone density in people who are active, and we see improved sleep patterns. Now this slide, I just want to make a quick point about the amount of exercise. This slide on the left-hand column shows risk of morbidity, or your risk of dying, up the left-hand side. And then the bottom is number of minutes per week of exercise. And the thing that I want you to note, first of all, is that obviously as you exercise, your risk of morbidity or your risk of death does decrease. But the thing I want you to really pay attention to is the slope of the line between the first dot and the second dot. It is much steeper than the rest of the line on the page. And if you follow that second dot down, it hits at about 70 to 80 minutes. If you divide that 70 or 80 minutes by 7 days a week, it comes to about 10 to 12 minutes per day of exercise. So if you start out with as little as 10 minutes, you can see the great benefit you get from just that little bit of exercise, dropping that line down significantly. And again, you do gain further benefit the more you exercise, but that first 10 or 12 minutes is a really beneficial amount of exercise. So don't always think, I have to get that 30 minutes in, or I have to get that 45 minutes in. 10 minutes makes a huge difference. The next thing we like to talk about in our program is the fact that weight loss is not a good indicator of health. Weight loss is tied to so many factors that if you use that as your litmus test for success, it can become very disappointing. A lot of times you'll hit plateaus as you're losing weight, so it can become somewhat of a hindrance to continuing the program. What this slide is showing is also, along the left-hand column is risk of morbidity or death, and then along the bottom is actually health behaviors. So the first column has a 0. That means they are not doing any of the 4 health behaviors. And then 1, 2, 3, and 4 under the other bars means they have adopted 1 health behavior. Now, these health behaviors they looked at in this research study were nutrition, improving your nutrition, increasing your physical activity, stopping smoking, or reducing alcohol intake to the recommended level, which is basically 1 drink for women and 2 for men per day as a maximum. But what this shows is the bars that are shown, the first bar is what we call quote-unquote normal BMI. The second is overweight, and the third is obesity. And you can see in that first column, when they're in the 0 column, that those who are overweight or obese have a very high risk of premature death. But as soon as they adopted one of those health habits, and it did not matter which health habit, their risk was reduced greatly. And then as they added other health behaviors, you can see that the reduction is equal across the board, whether it's, again, normal BMI, overweight, or obese. So don't use weight loss as your marker for success. We like to talk a little bit about stress in our program because it is a very important factor in weight management and in the inflammatory process in the body. Inflammation in the body leads to disease typically. Stress hormones are controlled through the autonomic nervous system, and we're not going to go into great detail here, but 2 of the main stress hormones are adrenaline and cortisol. These 2 stress hormones are great when the stress is short-lived or an acute stress. Unfortunately, in our society, most stressors are more chronic. They're all-day, everyday stressors, and when we have adrenaline and cortisol in our systems ongoing, they start to have a negative effect. We've listed some of those here. You start to see decreased bone density, we start to lose muscle mass, our immune system starts to fail us, our inflammatory response starts to wane, we have decreased pain tolerance, we see blood sugars get out of control, we see memory loss, and then the last one, it says telomere expression. Telomere is part of your DNA, and inflammation in the body affects your DNA, and your DNA is how your cells reproduce. The shoestring example is if you've ever seen your shoestring fray at the tip. That's kind of what happens to your DNA, and when that happens, the DNA does not reproduce itself properly, and this can lead to further disease in the body, very frequently cancers. So one of the best ways to reduce stress is through exercise. We call it self-stressing, meaning you stress your body purposely, then when you stop the exercise, your body recognizes that stress is gone, and it calls in the other part of the autonomic nervous system that shuts off the flow of those stress hormones, again, very specifically adrenaline and cortisol. So exercise is a great way to control stress. So give yourself a break, try a little bit of exercise. Don't feel that it's all or none, and just a little bit each day will make a huge difference. There is a saying that movement is life, and I can't agree with that more. Research continues to pile up to tell us that activity at any level is better than inactivity. Something as simple as getting up every 30 minutes from your desk and moving around has been shown to reduce your risk of morbidity by at least 30%. Hippocrates said walking is man's best medicine, and again, it's movement. Try to keep moving.
All right, Brent, thank you very much. We already have a bunch of questions coming in. We do want to let everyone know our email address today, ASKSSM@ssmhc.com. That's the email address that you can send in a question for Brent to answer. All right, this question we got a lot, both before the webinar and since it's been going on. A lot of people just wanting to start something, and if they're going to put in the time to exercise, they want to know what's the best exercise for them to do.
This is a very common question. We get that all the time. What should I do? What's the best exercise that I can do? And my standard answer to that is the one that you're willing to do. By that, what we mean is It has to fit you. We talk a lot about physiological age rather than chronological age. Chronological age is actually the number, and the number is not as important as what will your body tolerate. What is your body type, your likes and dislikes, what are your old injuries, that type of thing. So the best example I can give of that is when I was younger, I loved to jump rope for exercise. It was very quick. It taxed the heart and lungs very rapidly. It was good for the muscles in the arms and the legs. However, at 51 years old, jumping rope is no longer my exercise. That up and down junction is too much for my back, so that is no longer my exercise. But again, it's not an excuse not to exercise, but I had to find an alternative, and we'll talk more about that as we get further into the questions. So find something that fits your physiology.
You gave some recommendations early on in the presentation about how much time you should devote to exercising. When someone comes to you and asks you that question, how much exercise should I do, what's the advice you give them?
Well, here we like to really make the point of, certainly, we have the minimum of 20 to 22 minutes, and then you often see 30 to 60 minutes in a lot of the literature. But what we really want people to understand, again, back to the slide where it showed the big improvement from 0 to 10 minutes, you can break up exercise into smaller bouts. Especially more recent research is showing that smaller bouts of exercise are very effective. Now, it doesn't mean you can only do a small bout, but you can do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening, and it is just effective, and even some of the research suggesting maybe more effective than doing 30 minutes all at once.
That's interesting. Another question we saw a couple different times, what type of exercise should I do, aerobic, resistance, or flexibility?
Yeah, again, this is a question that we get in every class, I think. Possibly people trying to decide if they can focus on just one, and obviously the answer to that is we need to do all of the above. You need some aerobic activity. Ever since Jane Fonda started aerobic classes in the 80s, everybody knows what it does for the heart and lungs, and it is very important to get the cardiorespiratory system pumping, and it does burn calories while you're doing the aerobic activity. However, again, more recent research is suggesting that resistance exercise is just as important. It's important for heart health. We've known that it's good for density and bone health. And actually, resistance exercise is one of the few things we know of that increases resting metabolism, meaning how many calories do you burn when you're not exercising. So again, those folks who are interested in maintaining weight or maybe losing a few pounds, you cannot forget about resistance exercise because it will help you burn those calories as well. And then flexibility. Flexibility is very important. It has been shown to prevent injury not only during exercise but during daily activities. It helps to maintain good posture, which is very important to the vital capacity of the heart and lungs. And then also, as we age, it has been known to help prevent falls by maintaining joint flexibility.
Now, when you say resistance, give a couple examples of exercises that incorporate resistance.
Well, and again, that's a really good question because I think when people hear the word resistance, they think Arnold Schwarzenegger instantly.
Right.
You got to get pumped up. And that's really not what we're talking about. It does not take that kind of weight training or heavy resistance to make a difference. We are just talking about getting resistance muscles. And actually in our program, we frequently use lighter weights or dumbbells, and we use a lot of resistance bands to accomplish this. It does not take a stack of weights to get the resistance. We also talk a lot, again, trying to mix it up a little bit through your day or even what's available to you. Resistance exercise can simply be body weight. Doing push-ups against the wall, squats, that is body weight resistance that's going to be effective. So you do not have to have a lot of equipment or heavy weights to get resistance exercise.
We have someone emailing in asking what kind of exercise or activities do you recommend for someone who's been fairly inactive and has bad knees and hips. She says she loves walking, but after about 15 to 20 minutes, her hips start hurting.
Right, and this is very common. We get this in our program all the time, and it's hard if I'm not directly connected to that person. But in general, what we try to do there is, again, if you feel you can walk 10 minutes, walk 10 minutes. If 15 is too much, it's too much. Walk as much as you feel comfortable in what your body's telling you, but then find an alternative. And again, if you have bad knees, have bad hips, you want something that is low impact. Walking is low impact, but it's not non-impact. So you can find things. We have a device in our program called a new step. It's basically a sit-down stepper. You're seated in a chair, and you're pushing with your feet as if you're going upstairs. You're actually sitting. A bike obviously is helpful. Recumbent bikes are frequently better on the back for most people. So there is no impact with that. But again, too much of anything is too much. So trying to mix it up a little bit. Walk to the point that you feel you can walk and find something that is non-impact. And again, swimming is one of the best exercises. And when we say swimming, getting in the pool and moving. You do not have to be a great swimmer to get benefit from pool exercises. And most pools have someone available to help you get started and instruct you on some exercise. There are arthritis programs, senior programs that focus on water exercise.
That's a great point. I've seen this question a lot lately, even kind of in media stories. Are you supposed to be stretching before your exercise or after your workout wraps up, or both?
Right. Well, and I would say probably both. There is some mixed research on this. In general, what they are saying now is trying to do static stretching before exercise is not necessarily the best for you. So, trying to stretch your hamstrings with a 10 count, 20 count hold, not necessarily the best thing to do prior to exercise. What we suggest prior to exercise is more what we call ballistic stretching. And short of standing up and doing it for you, if you've ever seen a swimmer before they jump in the pool, they're shaking their arms, they're shaking their legs out, they're hugging themselves and throwing their arms around their body. That's what we call ballistic stretching. It warms up the muscles a little better prior to exercise or activity. So I would say ballistic type stretching prior to exercise, and then post-exercise, once the muscles are good and warmed up, then you might do a little bit of stretching if you have a problem area, tight hamstrings, that type of thing. Then a more prolonged static stretch may be a little more comfortable and actually have a little more benefit.
A lot of people work, obviously, in an office-type setting. What suggestions or advice do you have for people just to incorporate a little bit more movement into their workday?
Again, this is a very hot topic in the research right now because they are finding that it does not take that much to make a significant change in your overall health. Now, again, if you think you're going to lose weight with these little tips and tricks, that's probably not going to happen, but it does make a huge impact on overall health and what we call the biomarkers, trying to get the blood sugar down, avoiding the metabolic syndrome, that type of thing. But something as simple as getting up every 30 minutes, and some of the research says just walking to the bathroom and back can make a difference, but standing at your desk and doing a few mini squats, doing some toe raises, leaning on the desk and doing a few push-ups, anything to get the circulation changing. What we talk about in the Felician program is physiology. You need to bump your physiology through the day. So something as simple as a couple of minutes of leg exercises or calisthenics at your desk can be very helpful. The other thing we talk about, I'm a big believer in yoga and it's on the body. You can do yoga exercises literally seated in your chair at your desk. And those are readily available online. You can find these exercises nearly anywhere. We do always recommend, if you're going to start a yoga program of any type, study it, get some advice, learn the breathing. The breathing is a big piece of what yoga is about. So seek that information as well.
Our next question coming in, do short cardio exercises done in spurts really work?
Another great question because, again, everybody's asking the cutting-edge question. This is very popular in the research right now, what they call high-intensity interval training, meaning you go hard for typically 20 seconds, 30 seconds, then you get a rest period. And yes, it is very effective. They have shown this in the research. It can be as effective as running 30 to 40 minutes in just a 4-minute bout of what frequently it's called Tabata exercise. And again, it's usually 20 seconds hard, 10 seconds off. The piece you have to be careful of, you have to go at almost your physical maximum. So again, if you have problem areas, again, we recommend the bike for people with knee trouble, but if you get on a bike and pedal it as hard as you possibly can, your knee may not enjoy that very much. So again, Tabata or high intensity interval training is great for some, but not for everybody. You again, go back to that physiological ability of your body before you make that decision. But yes, it has been shown in the research to be very effective. It is not a substitute for cardio training, but it is a good, again, alternative or break through your week to not stress your body for 30-40 minutes of pounding and running and things like that. It's a little easier on the body, and you get a great cardiorespiratory effect.
So that would be a supplemental activity.
Exactly. Yeah, an alternative. Exactly.
Great. And by definition, you said that was 20 seconds on, 10 seconds off?
That is one. They actually play with that number quite a bit. And actually, to be honest, I do a little bit of Tabata in my office because I have a stationary bike. So over lunch, I will get on the bike 20 seconds hard, wait 10 seconds, 20 seconds, and you do that for 4 minutes. So literally, it is only 8 bouts of 20 seconds total with the 10-second rest period, and it is very taxing on the cardiorespiratory system.
All right.
But there are alternatives. You can do some of the research is 30 seconds on, 15 seconds off. So they do tweak it a little bit. But again, there is a lot of information on high intensity interval training. But again, be cautious because it is it's more than moderate exercise. It's a little higher level. And if you have an injury or a specific problem, it may not be the one you want to start with. Build up to that one.
Definitely not for everyone. This next person writing in wants to know if you have any ideas for a good cardio workout when you have knee problems. This person writing in has a torn meniscus.
Right. And again, most people, if they've lived long enough, have some sort of injury. Just as I was saying about my back, I can no longer do the jump rope. So you have to find that alternative. And if you've got bad knees, bad hips, that type of thing, and you can't really even walk, we suggest what we call upper body ergometers, which is basically a bike for the arms. That's a very easy way. The arms are actually closer to the heart and lungs and will tax the heart and lungs very quickly. So doing something along those lines. Again, the swimming pool is a great place to get exercise with less stress on the joints. So that's an alternative. And possibly even a machine similar to what I was talking about, the new step, where it's a seated exercise and your feet never leave the pedals. It is a very low impact exercise and the resistance can be adjusted. So there are a few pieces of equipment out there. I like ellipticals again because they're non-impact. However, not all ellipticals fit everybody's height, weight, that type of thing. Some of them can be very awkward and actually bother your knee more than help your knee. So I would be cautious trying those as well. Test it before you go too far on it.
That makes sense. A similar question, talking about someone with a herniated disc at T6 and T7, any exercises that they should be avoiding or any ones that you would suggest?
Well, again, without being directly related to that patient, that's a tough question to answer because if that's truly a thoracic disc that they're dealing with, a thoracic disc can turn very serious very quickly. Because it would affect what we call upper motor neurons that are coming down to the lower extremities and can cause bilateral paralysis, numbness, things like that. So without seeing that patient directly, I would hesitate to give much advice. Let's go back to that safety first rule. See your medical provider, ask for a referral to physical therapy. Your physical therapist should be able to guide you very specifically on what is and what is not safe for you based on your medical history. But a thoracic disc is not something that should be monkeyed with or experimented with. You definitely want some medical guidance with that type of an injury.
We've definitely had a lot of questions about someone who is having hip pain, knee pain, something like that. Are there personal trainers or yoga instructors, because that is such a good flexibility activity, are there trainers or instructors who do have special certifications for those people who have pain in particular parts of their body?
Yeah, as a physical therapist, obviously trained in total hips, total knees, those types of problems. and I hate to speak for other professions, I am not aware of any specific training for yoga instructors related to joint replacements or personal trainers specific to joint replacements. Again, probably the best to consult your physical therapist, ask them, are there things I should avoid? Are there ranges of motion that I should avoid? And again, it would be very specific to the person. We get joint replacement patients who do incredible and have basically normal range of motion, and then other people do get hung up with limitations and restrictions that can affect not just that joint, but joints above and below that. So I would say talk to your physical therapist, talk to your athletic trainer. They have definitely had some training specific to joint replacements. But as far as yoga instructors and personal trainers, I am unaware of their ability based on specific training on joint replacements.
All right, this next question, pretty in-depth, so let's make sure you're listening. Okay, someone's writing in saying, I'm active, lifting weights 4 times a week, also doing the step mill 5 times weekly for 45 minutes. She's never tried high-intensity training, and she's wondering if it would be better for conditioning versus an extended pace of, say, 9 on the step mill for 45 minutes. She's wanting to know your thoughts. Her goal is not to deplete muscle, but to continue to maintain muscle while tightening up. She says she eats clean, has higher protein with carb cycling, and only allows herself one cheat meal, and that's on the weekends. She's doing pretty good. That's what I have to say.
Yeah, first of all, pat yourself on the back for doing such a great job. But it does actually bring up a piece of the research that is starting to emerge, and that is, again, the interval training and the shorter bouts of exercise. Not knowing this person's age limits me to a degree, but as we age, our bodies do not respond to exercise quite like they did when we were in our teens and our 20s. And basically what we discuss in our program with people is that joints and ligaments and tendons all have basically a point that they break down. So as we age, if the muscle, tendon, ligament, cartilage is not quite as responsive, sometimes being on a device for 45 minutes straight, you may get past that point of no return, so to speak, where you might cause an injury. So trying to do that 45 minutes, 5 days a week, number one, it's the same exercise. You need to vary it a little bit. So find an alternative way to get that type of workout. But again, even that high intensity interval training is a great way to break that up so you're not doing it every single day. So maybe on an alternate day, you might want to try that. Again, that shorter spurt of exercise is going to be way less taxing on the joints, cartilage, ligaments, tendons, that kind of thing. And actually, you may see a better rebound effect. Give it that rest in between. 5 days straight of the same exercise does not allow for a recovery period. So again, you may substitute every other day with the high-intensity interval training to see if you can maintain, not lose anything, and actually give your body a little bit of a break.
Great advice. This next question coming in, we're seeing a lot as well, a problem for a lot of people. She writes in saying before having children, exercise was a daily routine, something that she said wouldn't go away after having kids, but now her and her husband struggling with fitting in exercise. She's looking for advice as to how best squeeze in exercise while realizing that sleep is important for staying healthy in both the short and long term. Looking for some advice.
Okay. Well, first of all, the sleep, mentioning sleep is certainly very important. Sleep is a foundation of health. So if you're not sleeping well, that would be the first thing to look at. So it's good that they're at least thinking about that. And sometimes exercise actually helps you to get to sleep. It taxes the body, normalizes the physiology, and can actually improve the sleep cycle at times. So that would be one thing to keep in mind. But again, for somebody who's that busy and has that kind of schedule, I'd refer back to number one, that contingency plan. Think about your day, schedule it for yourself, and you're going to get interrupted with kids, so having an alternative. But again, breaking it up into smaller pieces would probably be the best. If you can squeeze in 10 minutes of a morning, maybe before the kids even roll out. If you get them off to school and you can get another 10 or 15 minutes before lunch or later in the afternoon before they get home from school, and then after you put them to bed, if you can get 10 more minutes, you've gotten 30 minutes that day. And it is, like I said, as effective or more effective than 30 minutes all at once. So looking at breaking it into those smaller 8, 10, 12-minute increments, and again, mix it up a little bit. Aerobics one session, body weight resistance another session, that kind of thing, so that you don't get bored with it. But certainly it is a challenge, but it can be done if you break it into those smaller bouts. And like I said, possibly even more effective than 30 minutes all at once.
I think that's an excellent takeaway, that breaking it throughout your day still makes an impact. I think that's really
Absolutely.
Key. Another question coming in, someone writing in saying she knows all the facts about health but feels like she just doesn't have the discipline or consistency to actually put it into practice. Do you have any suggestions for her to help overcome this behavior?
Yeah, come join our program. That would be my advice. But, and I'm joking, of course, but find a program. That sometimes when it's tough to motivate yourself, find somebody who will. Linda works with me here at the Felician program, and she's got enough motivation for everybody. She moves them, she keeps them engaged, she keeps them energized when they're there. We have Coach Carpenter as well. He is an exercise guy, and he gets them motivated. Find those groups, and they're everywhere. They really find a group, and again, that kind of fits your physiology. I mean, you know, I hear people talk about Zumba. Zumba is a great aerobic activity, but not for everybody. It's high intensity, so that might not be your group. But find a group that interests you, and again, that motivation comes because you feel as though, hey, I can't disappoint the group or my buddy in the group. They're expecting me to be there. When you're struggling with motivation, find a workout buddy group, find somebody who's energized, and they'll energize you.
We talked a couple minutes ago about exercising and incorporating some exercises into your daily life while you are maybe sitting in an office or your normal work schedule. Someone wants to know, you know, if they are fitting in exercise either before or after the day, say 30 minutes in the morning, 30 minutes at night, does that undo all the sitting, those 8 hours of sitting during the day?
Again, that's a great question because there is some very recent research on that. If you sit all day long, it does somewhat undo the 30 minutes that you've done prior or post. One of the research studies they referred. That's not what we
wanted to hear.
I know. But again, it actually takes some of the pressure off. Realizing that maybe not doing 30 in the morning, 30 in the afternoon, and then sitting all day, realizing that if you just get up and move around a little more through your day, it's going to make a bigger difference. One of the research studies was referred to as sitting is the new smoking. You know, if you sit all day, it's as detrimental to your health as smoking. So again, obviously a problem if you are stuck in a cubicle or at a desk 8 hours a day. There are things now where they have stand-up desks where you just stand up and work at your desk. You don't really even have to move much, but you're just standing rather than sitting. So if there's a way to accommodate that in your workstation where you stand for 3 minutes, 4 minutes, 5 minutes every 30 minutes to do your work, or again, if you can just get up and move at your workstation. Nobody says you have to even leave your cubicle, but get up and move around. Do some of that ballistic stretching. Shake your legs, shake your arms, get the physiology going for a minute or two. It makes a huge difference. So trying to incorporate that into your day certainly can make a difference. But yes, if you sit for 8 hours a day, it will undo a lot of your hard work, unfortunately.
Did you see that the sitting rising test that it was probably a couple months ago?
Yes.
I think.
Yeah, that's actually been around for quite a while, but it's gaining popularity again.
What are your thoughts about that?
Well, it is one of several tests that they use to just indicate your general health. And again, it is, obviously you have to have strength, you have to have core strength, leg strength, balance, that type of thing to be able to get up from that seated position. It is somewhat difficult. There are tricks to it as well. which kind of make it a iffy test on some fronts, because if you know the trick to getting up from that posture, it does make it easier. So someone who's not familiar with the test, or it's not been explained well, you may sit in the floor and think, oh my goodness, I'm so out of shape, I can't hardly even budge my bottom off of the floor. But there is a bit of a trick to it. It is one of many indicators that we have used over the years to indicate somebody's general health, but there are several others. So, and again, it goes back to that physiological age. If you have an old ankle injury, an old knee injury, an old hip injury, you're going to struggle with that particular test. So that one test does not tell us everything about your overall health. So keep that in mind. But yes, it is a test that has been used to indicate overall health, or one of the indicators.
Interesting. Someone's writing in, she had some weight loss recently and wanting to know if there's any exercises that will specifically target the area under her upper arms. That's, one of the areas where you do have, when you do have weight loss, you see some extra skin in that area.
Right. And really, the research doesn't really tell us specific. If somebody is wanting to lose belly fat, they a lot of times do more sit-ups. There is no indicator that doing sit-ups reduces the belly fat. It goes all the way back to just moving more and getting the physiology going. So again, the knee-jerk reaction to that question would be do some triceps exercises to reduce that area. Now, I will say that doing some triceps exercises may tone up the muscle underneath and give that area a little bit more of a toned look. But to say you're going to lose fat in the back part of your arm because you're doing triceps exercises, probably not exactly true. You need to just move more, and that will reduce overall body fat. And your body, unfortunately, kind of picks and chooses where it likes to deposit it for you. So some people have quote-unquote trouble areas. But again, if you're worried about losing the weight, I would say just keep moving and move a little bit more each day. If you're just wanting to tone that up, some triceps exercises with, again, a light band, a light weight certainly will help tone it, but it will not make the fat in that particular area necessarily disappear.
Let's talk about a weight ball. What are the benefits of using a weight ball, and how should they be used?
Well, I'm assuming you mean just a medicine-type ball with no handles. Kettlebells are very popular right now, but a weighted ball, again, is just a form of resistance. So they can be used in a lot of different ways. One of the areas that we utilize is what's called PNF in therapy lingo, but it's just a fancy way of saying functional movements. We use diagonals and rotational movements, so lifting from high to low on a diagonal frequently. And the nice thing about the balls is you can use both hands and get some more of what we call functional movements. So someone who has a job where they have to twist and bend and reach more, certainly it's a great way to try to increase core strength. And again, there are actually classes. We do an entire class sitting on balls and lifting weighted balls for core. It helps with core strength, coordination, those types of things. And if you're truly interested in starting something like that, there are several places you can get information on that online to see depictions of the different exercises. You can use Swiss balls and do it from a seated position. You can do it from a standing position. But it kind of allows core strength in functional positions, basically.
That makes sense.
And again, a great way to break up the monotony of a weight machine or dumbbells and that kind of thing. Everybody's done those. So.
Right, absolutely. We have a viewer writing in saying her mother is in her late 70s, has diabetes and other health issues. She needs exercise, but she's definitely tiring easily. They got her a 2-pound weight ball to use. Is that too much for her? And are there any other things that you could maybe suggest?
Right, and we see that and again, for those of you who aren't that age and don't have those medical conditions, kind of heed that as a warning. There are lines that we cross through our life where it becomes harder to get back or to come back from that. So again, you are a little deeper with physiological age here. It sounds like, especially with the diabetes and that type of thing. And again, I don't know her body type or composition or overall physiology, but certainly she needs to incorporate, again, all the above. you have to get moving somehow. And at that point, even if it's just taking multiple walks throughout the day from one end of the house to the other and back, purposely, not just going to the kitchen or going to the bathroom, but every 30 minutes I'm going to walk to the end of the hall and back to stay moving. It's a great start. Okay, and again, not exceeding her abilities, obviously. A 2-pound ball does not sound as though it would be too much starting out, but it depends on what she's trying to do with that ball specifically. Again, watching joint ranges of motion, not trying to get the ball too high overhead. We don't worry about that as much. The range of motion above shoulder level at that age may be problematic and more stressful to the rotator cuff, but certainly doing arm exercises closer to the body with a 2-pound weight would probably be appropriate without knowing the patient specifically. But again, overall just movement, working on some flexibility besides the ball and the walking, doing ankle exercises, very important as we get into those decades of life to prevent falls, keeping the head and shoulders up and back. Very important to prevent falls. The weight of the head and the shoulders getting ahead of the body certainly can cause falls in people who are into the 7th decade of life frequently. So don't forget that flexibility, and just simple posturing and trying to get the shoulders and head back, that type of thing, would be a great place to start.
A viewer emailing in wanting to know if you could explain open-chain and closed-chain physical activities.
Yes, that is basically all it's saying is your foot's on the floor or your foot's not on the floor for the most part. Open chain means your feet leave the floor. So again, probably some impact, whether it's high velocity or lower velocity. But open chain, the feet leave the floor. Closed chain, the feet always remain on a surface, and I shouldn't even say floor. If you're laying down and you have your feet on a platform and you're pushing, but your feet don't leave the platform, then certainly that is a closed chain exercise. The feet stay in contact with the planet, basically.
While doing cardio exercises, what heart rate should one reach and for how long?
That is a common question, and there is no one good answer for that, because it is basically 220 minus your age, and then you multiply by the % of activity level that is appropriate. So again, we've harped on the appropriateness. So starting out, it may be 220 minus your age times 40%. But as you improve, then you may move that target up to 50, 60, 70% as your target. There are some very nice pictures of this on the internet that show you exactly how to calculate that. But again, it is somewhat arbitrary because it has to fit you. So again, possibly even talking to your medical provider about where do you think I should start on this graph, 220 minus the age times a %, because the % is the piece that's really telling you this is where I'm starting, this is my physiological age as of today, this is where I'm going to start. So if I start at 40%, my goal may be to get to 60% over the next 3 or 4, 5, 6 months. So again, it's a great way to monitor your progress, but it's very difficult to say, here's where you need to start. So the % would be very much based on your current physical condition and how much you've been exercising and your overall physiological age.
That makes sense. Another viewer emailing in saying, my doctor told me I need to lose 60 pounds. I've joined a gym and go 5 days a week. I'm doing 30 minutes of cardio, then 45 minutes of resistance on a low-carb diet, taking prescription diet medicine. Been on this routine for 6 weeks, but still not losing any weight. Any suggestions?
Patience. And that's an easy thing for me to say, but it's the truth. Weight loss is, again, not a litmus test for overall health. I understand, and again, I don't know why the doctor's saying lose the weight, if it's to take stress off the hips or the knees or the back or something like that. But we go through this almost on a daily basis at the Felician Wellness program, and trying to get people focused away from the weight. Weight is combined with so many other factors, hormones in the body, stress. I mean, again, without knowing this person personally, it's difficult for me to tell them exactly what to do. Certainly if they have a high-stress job, can be a huge effect on inability to lose weight. Stress hormones promote weight gain. So trying some sort of relaxation technique. I'm a big believer in breathing techniques if you're under a lot of stress. But again, not knowing this person specifically, I don't know that that would be appropriate. But it sounds like they're doing a lot of the right things, and there is no question that if this is the program they have been on, physiologically speaking, in their body, they have made enormous changes, and they should be very proud of what they've done, regardless of what the number is. There are other things that can be checked in our program. We check body fat electronically, which is not a perfect test. We also look at waist measurements. I don't know if this person had a waist measurement. Sometimes the waist measurement will decrease, but the body weight does not fluctuate that much. Again, midsection, if you go back to that metabolic syndrome we were talking about, abdominal obesity is an indicator of poor health. So sometimes you lose inches in the waist, right at the belly button. You notice that that's improving even though the weight is not changing. So maybe change their litmus test, so to speak. Don't use weight as your test for success. Maybe look at waist circumference. And again, hopefully their medical provider or somebody can help them with that to take some of the focus away from how much do I weigh today. It can be a detriment to the person's motivation, and it sounds like this person is doing everything right at this point, so they should be very proud and continue with what they're doing because they're doing it right.
Absolutely. Any examples you can give of flexibility and balance exercises that people can do, maybe just in their home?
Absolutely. It's called yoga. I told you earlier I'm a big believer in yoga. It needs to be done properly. I always suggest that somebody go to a qualified yoga instructor, go to a class if that's available. If that's not available in your area, there are many good yoga books, yoga tapes. The public library usually has CDs and books on the topic. It's online. You can find a lot of programs online. But yoga is a big bang for your buck exercise because it does flexibility, it does some strengthening, and the thing that it also does is, again, any good yoga book, yoga tape, yoga instructor should go into a lot of detail about the breath. And the breathing is very much cardiorespiratory. The sympathetic nervous system that we talked about earlier that helps to reduce or increase the stress hormones, the epicenter of that lies directly behind the lungs. And as you do the yoga breathing, you're actually massaging or manipulating the sympathetic nervous system, which can have huge benefits health-wise. So if somebody ever asks me, what can I do to feel a little bit more limber or flexible, I always suggest yoga. And again, it doesn't have to be a 30-minute program. A short bout of yoga, 8 minutes, 10 minutes, 15 minutes, you can do it anywhere. We talked about being able to do it in a seated position. You can do it in your bedroom, your living room at home. You can do it at the office. It is a very convenient exercise, and it kills or hits all of the areas that you need to address.
One more question coming in about resistance training. With your advice, your suggestions, in a perfect world, how often would one do resistance training per week, and should they be switching up the muscle groups that they're targeting with that training?
In general, I would say 3 times a week would be kind of a perfect scenario because, again, back to that rest period. We talked about it with the cardio, the 45 minutes of cardio. It's the same with the resistance training. 2 times a week is kind of a minimum. 3 times a week, I would say, would be perfect because you alternate days. And if you were going to do days back to back, absolutely, you would want to switch it up. So if you're going to do full body resistance on one day, you need to skip a day. If you're going to do upper body one day, then yes, the next day you could do lower body, but never do the same muscle group 2 days in a row. Give it that day of rest. That's when the muscle is actually rebuilding itself and gaining strength. Technically, what you're doing with resistance is you're tearing down the muscle just a little bit so that when it rebuilds, it's stronger. So you have to have that rest period and that recovery period.
That makes sense. Well, that was our last question. Before we head out this afternoon, do you have any last words of advice for those people who really just need to take that next step, get up, get moving? I think you had some awesome takeaways today. Any kind of words of encouragement for everyone as they go about their day?
Well, I have to go back to that quote, movement is life. There is nothing truer than the fact that you just need to move. The research is just overwhelming, especially in the past few years, that it doesn't really matter exactly what you're doing as long as you're doing something. If you're walking, that's great. If you like certain forms of activity outdoors, that's great. I think the biggest problem is there are too many areas in society where we get distracted, you might say. The Biggest Loser. It's a great entertainment show. It is so far from reality. I would suggest if you're serious about exercise, you probably and have trouble with motivation, don't watch it. Nobody has those resources. Nobody has a trainer with them all day, every day. That type of exercise and weight loss is not normal. So we see these things and we think, oh goodness, I need to be flipping tractor tires and going on the treadmill until I throw up. That is not reality. So don't pay attention to social media and fads and those types of things. Realize that any movement is better than no movement at all. Start very slowly. Increase, set your goals where they're attainable, because when you reach a goal, you're ready to go for the next goal. So make sure that you start in an appropriate place and build up slowly.
Such great information. Thank you so much for being with us today. And thanks to everyone out there who watched. We'll make sure to put this online so you can watch it again and get some of that great advice from Brent. And everyone have a great rest of your day.